Good morning, and thank you for joining us. We're here today on Treaty 7, and we recognize the First Nations, Métis, and Inuit people who've cared for this land since time immemorial. Seniors across Alberta are struggling with the cost of living. The UCP government has already started increasing people's copays for their drugs by $1 a month until it reaches $35 in the spring. This is a 40% increase to the copay at a time when many Albertans, especially those on fixed income, are really struggling. So we're here today to share a leaked document. It's a UCP cabinet report that has been shared with us. And it shows that Danielle Smith and her UCP government have been working on a secret plan to charge Albertans hundreds of millions of dollars more for their prescription drugs. Instead of setting up a program that would help Albertans struggling with the UCP's affordability crisis, they're planning the opposite. And they're doing it in secret. Average income seniors will see their costs go up. It says it in black and white in this very report. It says upon implementation it will cost Albertans as much as $400 million more per year. It's a plan to force many seniors to choose between following your doctor's orders or paying for your prescription drugs, or choosing food, skyrocketing rent, or out of control utilities. It is unconscionable. They've already kicked dependents of seniors off the drug plan, meaning that if you have a younger spouse or a child who's dependent, even a grandchild that you're raising, and you're paying for their drug costs, they're not allowed to be on your drug plan. They've increased the co-payments by charging Alberta seniors that extra dollar per month, escalating till the spring. And this increase, again, is going to be crippling for many, especially if you're on 3, 4, or even more prescriptions. That 40% increase really adds up. And the UCP refuses to work with the federal government on rolling out a pharmacare plan for diabetes medication or for contraception. And the secret next steps outlined in their own leaked cabinet report show that the UCP is considering creating a program that shows that the increases will go up for average Albertans. The anti-pharmacare plan here in Alberta would income test and require more people to pay out of pocket, charging 30% of the cost for that prescription. The UCP says that it will save the government $300 to $400 million, but those costs will be passed on to those who are filling their prescriptions. And the proposal also suggests that an average senior couple would pay hundreds or even thousands more for their prescription drugs under this scheme. And according to the leaked cabinet document, the final step of the anti-pharmacare plan is to force Alberta seniors onto the plan. This cannot be allowed to happen, and that's why we're releasing this information for you today. Albertans need to know that what the government is planning because Danielle Smith won't tell you. You can't listen to her words, you must watch her actions, and they are self-serving, arrogant, and making life so much more unaffordable for so many. So I'm happy to turn things over to the leader of the Alberta Democrats, my leader, Naheed Nenshi, to say more about this very serious issue.
Well, thanks very much, Sarah, and thank you everyone for joining us in the room and online. You know, for many months now, we've been talking about the 4 C's of this UCP government and this terrible premier. Chaos, cuts, corruption, cruelty. And on the healthcare file, and particularly on this pharmacare memo that we've seen today, we see all 4 of those things together, coming together really in an area of sheer incompetence. Danielle Smith and her ministers are now going to tell us, oh, this is just an advice to cabinet memo. We don't know if we're going to implement it. But that's actually precisely the problem. Changes of this magnitude shouldn't be cooked up in back rooms and secret memos. They should be open. They should be transparent. We should discuss them with people. We should let Albertans discuss the costs and benefits of this kind of change. Instead, what we know is that this document has a number of steps. And it's all about saving money. It's not about improving services or making people better off. It's about saving money. I like saving money, but you can't save money on the backs of people on fixed income. And the first step was to increase those copays. So think about this. The copays will go up $40 a year per drug. So if you're someone like my mom, a typical senior who gets her blister packs from the pharmacy, she's got 10 to 12 prescription drugs. That means that her annual cost on a fixed income is going to go up somewhere between $400 and $500. This was no consultation, it just happened, and there is no protection for lower income seniors in all of this. Everybody has to pay. So this report says that should be the first step. The next step in November is to introduce this bigger plan, this means-tested pharmacare plan. When the government announced the increase to the copays quietly this summer, right on schedule according to the memo, they didn't say there was another shoe come to drop. They didn't say that there was another plan. They didn't tell us that this was the first step in a massive overhaul of the system that has had zero consultation, zero stakeholder input, zero expert advice, and is based simply on one very expensive secret report from a consulting firm. I used to be a management consultant. I was a pretty good one. But I sure wouldn't want the government to spend billions of dollars and make massive changes to people's lives based only on my opinion without talking to anybody else. For months now, we've been hearing from seniors across Alberta about their financial burden, and in particular how much more of a financial burden this copay increase has been. It's no surprise there's not a single Albertan, who would say that the healthcare system is better off now than it was in 2019 when the UCP took power. There's not a single Albertan who would say the healthcare system is better now than it was almost 3 years ago when Danielle Smith took power. Costs are going up, wait lists are increasing, they're making you pay more for your vaccinations and for your prescriptions. It's just another plank in, well, I like to call it the UCP's Make Everything Unaffordable plan. But that would be too nice to them because they don't have a plan. And it's their lack of their plan that is making everything unaffordable. Whether it's insurance, and we just heard today that they're raising the cap to give the insurance companies more money to take us from the most expensive auto insurance in the country to really the most expensive auto insurance in the country. Whether it's the cost of rent, housing, utility bills, their lack of action against big corporations, even on grocery bills and shrinkflation, this government will not stop draining you. And they are ruining the Alberta advantage, and they're ruining the affordability in this province and creating an affordability crisis for average people. Yet they waste money like nobody's business. The UCP, Danielle Smith, has increased spending more in her first 2 budgets than Rachel Notley increased it in 4 budgets. And Albertans are not seeing the benefit of this. You're not seeing better education. You're not seeing better healthcare. You're not seeing better services. You're seeing $100 million thrown away on Turkish Tylenol that nobody wanted and nobody used. You're seeing hundreds of millions, if not billions of dollars through the corrupt care scandal being spent on private surgical facilities. And you're seeing separatism being pandered to, which is scaring away foreign investment. Or any investment, really, in Alberta. I shouldn't have said foreign because the CEO of one of Alberta's largest companies, ATCO, has said she's not going to invest a penny in her own province in Alberta until this separatism garbage goes away. No joke that we now have the highest unemployment rate in Alberta outside of Newfoundland, the highest unemployment rate in Canada outside of Newfoundland here in Alberta. The youth unemployment has never been higher. And the hits just keep on coming. Yesterday, we learned that a figure at the center of the corrupt care scandal, one Jitendra Prasad, worked for the Alberta Surgical Group while he was being paid by AHS to advise on negotiations with the Alberta Surgical Group. I come from the world of business. I've negotiated lots of big contracts in my life. That is not how you negotiate a contract that brings value to the other party, or in other words, saves money for taxpayers. It's difficult to imagine how that is not a conflict of interest. And yet, the Premier's response is, nothing's wrong here, look away, we're not going to have a public inquiry. We've now been waiting 8 months for the truth on this. The government steadfastly refuses to call a public inquiry, and they stall their own report. So in the new document says, quote, Mr. Prasad was exposed to confidential information about the ASG contract negotiations while he was employed at AHS, and subsequently appears to have represented ASG in pricing negotiations on the same contract. Come on. Now, the shocking thing about this is this report, this secret report from a very respected law firm, is precisely the report that the Premier has continually relied upon to say that report exonerated her and her government, that it said there was no problem here, there was nothing to look at here. And we asked probably about 100 times in the House this spring for her to release the report. Not only did she refuse to release it, she admitted at one point that she had never read it. So she was relying on a report she had never read, saying it exonerated everybody, and that report clearly says that this guy worked for both sides of a major multi-million dollar, if not billion-dollar contract. Albertans deserve so much better than this. And let's be clear, I'm not expecting anything from this report. We have a respected judge doing it, but he has been completely straitjacketed. It wasn't a public inquiry. It was on the UCP's own terms of reference. He didn't have the right to subpoena witnesses. And we learned this summer that he didn't even interview the former CEO of AHS, the ones who started all of this, the whistleblower. He didn't even interview her until after his original deadline had passed. So Albertans would be forgiven for asking. We spent hundreds of thousands of dollars on this report already, if not a million or more. And Albertans would be forgiven in asking, what the hell were they doing over there? Clearly, they're not interested in getting to the answers. And we said to the Premier many times, look, there's an easy way out. The easy way out is call a public inquiry. She has steadfastly refused to do so. And I'll tell you this, the only government that won't call a public inquiry on something like this is a government that has something to hide. Yep. Now, furthermore, the other interesting thing about this memo that was leaked today is that it doesn't actually talk about, a really important thing, which is we now have a federal government that is interested in a national pharmacare plan. And former Minister LaGrange, still a minister, but she's not in charge of this stuff, I don't think. Who knows what these four health ministers do? But nonetheless, Ms. LaGrange has said that we don't want the federal money for contraception. We don't want the federal money to help people with diabetes pay for their medications. So basically, we got a plan from a private consulting firm that completely ignores the fact that there are billions of dollars on the table from the federal government. Why wouldn't we work with our other provincial partners and the federal government to achieve economies of scale to create a regional or a national plan? Albertans deserve so much better. We deserve a government that prioritizes our needs and lives up to the fact that governing is a responsibility. It's not a political game. That real people have real impacts from the decisions that these guys make. They never think about that, or they think that cruelty is the point of what they do rather than a byproduct of it. We have a responsibility to protect our public health care system, ensuring that life-saving medications remain accessible to all Albertans. We have a responsibility to ensure that no one in this province is choosing between medications and groceries. We have a responsibility to work with the federal government to implement programs that save money for everyone, save money for government and save money for citizens, like the start of the National Pharmacare Program on diabetes medications. When I think about people like my mom, she worked hard every day of her life. She never earned any real money, but she was able to save a little bit. My dad had a little bit of life insurance, and thank goodness Mom is able to have a decent income in her retirement years. But it doesn't go up. Inflation is hard for her. She worries about the price of groceries. Thank goodness I'm there to help and my sister is there to help. But she worked hard to build this province. And she and all Alberta seniors deserve so much better. You deserve so much better. You deserve a government that will make your life more affordable. You deserve a government that will invest in public health care, in education, in housing. Most important, you deserve ethical leadership. You deserve a government that is open and is transparent, that tells you what they're thinking about, that involves you in the decisions they make, that isn't interested in pulling our country apart for political purposes, that isn't interested in undermining universal public health care, and isn't interested in saving you money. You deserve so much better. So with that, Sarah and I would be very happy to take any questions.
All right, we'll start with questions in the room. Okay, no questions in the room. We'll move to the phone lines. Just a reminder to use the raise hand function or *9 to get to the question queue. And please let us know who you are addressing your question to. So we will start with Sean Amato, City News. Sean, your line should be open.
Good drivers is going up 7.5% next year, even more for, bad drivers. Some people online are pointing out that, the Alberta government is offering teachers 3% raises, for example, but 7.5% more for auto insurance. Can we just get your reaction to that, please?
We knew from the beginning that the UCP's auto insurance affordability plan, which was cooked up by insurance company lobbyists, was never going to save anyone any money. They always said your premiums will increase from the highest in the country to the highest in the country, 15% over 2 years. Now we know they'll go up even more than that. And in 2 years' time, you lose the ability to sue if you're in a catastrophic accident. This was never a good idea. And it shows how this government works. They don't listen to experts, they listen to lobbyists. The latest lobbyist to catch the Premier and her Chief of Staff's ear gets what they want. And they don't think about what's important to Albertans. We can do so much better. And when we think about the fact that in Alberta, Albertan drivers pay between $2 and $3 billion a year more in insurance premiums than in our next door provinces of British Columbia and Saskatchewan, very conservative Saskatchewan. We know that there are better options out there. And the Premier lifted a trial balloon for just a second this summer saying, maybe we should look at the public option that our own reports say is a better option. And then she shot it down herself within 24 hours because the lobbyists got to her. We deserve so much better than that. Do you have a follow-up, Sean?
I do. So will you commit, if you become Premier after next election, to a public insurer in Alberta?
Sean, I feel like you ask great questions to which the answer is always the same, which is stay tuned. Stay tuned. We have actual real experts advising us who don't have financial interest in all of this on what our plan should be. What we know right now is the plan that the UCP is putting forward will not work. It won't save anybody money, and it takes away people's fundamental rights. So we're going to come up with something much better. Stay tuned.
Our next question is from Catherine Grigowski. Catherine, your line should be open.
Thank you very much. So the report says that the lowest income, most vulnerable won't be affected by this proposal, but higher income seniors may need to pay more.
Yeah.
So I'm wondering, what's your argument for a universal pharmacare versus a means tested?
So here's the critical issue here, right? If you are going to create a means tested program, then there's a very simple concept, which is the average person should be the same or better off. And what's happening here is very, very, very poor people, seniors who are earning under $30,000 a year total, or people on AISH, might be slightly better off. People who are high income will be much worse off, and the report suggests that higher income seniors could be paying as much as $10,000 more, and that mid-higher income seniors will be paying 3 to 4 or 6. It's a little unclear. The math is hard to follow, but anywhere between $3,000 and $6,000 more. But the number one issue, I think it's on page 4 of the document, is that the average senior will pay more. And if you're going from a universal to a means-tested program, you can never do it when the average person is paying more, when the average person is worse off.
Do you have a follow-up, Catherine?
And I note that in the report it says one of the risks is non-compliance. Like maybe if seniors are having to pay more, they won't take some or all of their prescriptions. Can you speak to what's at stake?
Yeah, I'll let the former health minister answer that as well, because this is something that she had to deal with all the time. But here's the thing: penny wise, pound foolish. If you create a system that has people not taking meds for their chronic drugs, for their chronic conditions, for example, you're going to get more emergency room visits. You're going to get more hospitalizations. You're going to cost the system much, much more, and people will live a much worse quality of life. I'll give you an example. I've got a senior who's a friend of mine who has, it's probably a little bit intimate, but I'll tell you anyway, has a problem with an overactive bladder. And the medication that she was prescribed for it cost $67 a month because she couldn't get a special authorization on the senior's health plan. And she can't afford $67 a month. So instead, she's living with incontinence, and it is ruining her quality of life. She can't go out. She can't go anywhere. She needs to be within arm's length of a bathroom. These are the things that we can fix. She could have such a better, more productive life if we were able to get these things right. But I'll turn it over to Sarah.
Thanks so much, Naheed. I'll just add that the example he gave is an excellent one. So is the fact that I did actually check, and the minister responsible is the one for primary and preventative care, because taking your medication is about prevention. So if we know that people aren't taking their medication, already some are struggling with $25, it going up to $35 has resulted in many seniors saying, I'm just not going to take my pills every day. I'm going to take some every other day so I can scrimp and save. And then they end up in the hospital. And that costs all of us more. It means that we have longer waits when we show up to the emergency room in a true emergency because somebody else is there because they didn't take their medication as their doctor prescribed because they couldn't afford it. So universal programs like pharmacare that the federal government's proposing are about keeping diabetics well and in their community, productive, working, contributing, and having a good quality of life, and keeping our hospitals less full. So it really is about that individual having a better quality of life and all of us having better health care when we make these things affordable for everybody.
All right, our next question is from Jack Farrell, Canadian Press. Jack, your line should be open.
Awesome, thank you. It's a real technical question that I'm hoping Sarah might be able to answer. So the report talks about Alberta moving itself to become second payer status rather than first payer status, and then it talks about how there is, however, concern that legislating second payer status may lead to private insurers capping their benefits or reducing their something to protect against unlimited liability. So can you just, do you know exactly what that means? Like, what does second payer status mean and why?
Yeah.
What impact would it have?
Thank you so much for the question. It was something that I was given as a way that government might be able to save money when I was health minister too. And I said, no, thank you. I'm not interested in causing a bunch of chaos. So for example, if you're a retired teacher, you have benefits being a retired teacher. And right now, if you're over 65, you go through the seniors drug plan, and then whatever that doesn't cover, then your retired teacher benefits cover. The government in this document is proposing the opposite, so that you go through your retired teacher benefits, which teachers are paying into. So that probably would drive up their premiums and having to pay more into that program. And it also means that that they still might end up paying more out of pocket because they're going to the other insurance models first and then relying on the government one second. And this isn't something that we've ever had in Alberta. It's something that we've done the opposite. We've said when you're a senior, you've contributed to the success and prosperity of Alberta, you have benefits as a senior in Alberta, and that should be your first benefit plan. Did you want to add anything, Naheed?
I mean, I could get super nerdy about the concept of moral hazard, but the idea here really is just as Sarah says, if you want to do something like this, you don't spring it on people like this. You have big consultations with the benefits programs and so on to ensure that you're not accidentally or on purpose creating more cost for the whole system. So you might be saving $1 here, but the retired teachers plan will pay way more, which means that eventually that'll show up in the collective agreements of teachers. So it's just a matter of getting this right and making sure that even if you were considering this, this is something that needs a lot of work, a lot of actuarial work, a lot of work with benefits providers, because as you say, Jack, the risk that's highlighted in the memo is that just means that these private plans will start capping very low and forcing their costs onto the public purse. And we don't want to inadvertently create a system where we're nationalizing or making public what have been private costs.
Jack, do you have a follow-up?
I do. That was very helpful. And then a bit more of a political question for you. Near the end of the report, it has a little list of expected critics, and it covers health providers, seniors advocacy groups, the media, lower and middle income Albertans, which covers government-sponsored drug coverage, seniors, and then everybody that would actually be affected by the switch to Alberta Pharmacare. And then on the expected supporters list, it includes MLAs, Albertans who support fiscal responsibility, and Albertans who believe that seniors can and should pay their fair share. What do you guys think of that list? Those lists, sorry.
Oh, I feel a bit bad that Sarah Hoffman only appears as number 7, I think, on the list of people who will be mad. They should have been smarter than that. No, I mean, this is a typical thing that, you see in a cabinet memo, I think.
Yep.
Right, Sarah? But in reality, this is kind of a shocking one because it says, everybody will hate this. Everyone impacted by it will hate it, and only the base that we pander to, who doesn't think they will ever be seniors, will be happy. And this is typical for this government. They don't look at the impact on real people of their decisions. They only look at the political impact on whether they think it'll gain them a vote or get people mad. This government thrives on endless rage among Albertans. And so if I were to read this, I'd be like, ooh, we don't have any support for this. This government will read this as saying, this is going to make people mad. Perfect.
All right, we'll do one last pass for questions. No more questions with that. That concludes our press conference. Thanks,
Thank you,
folks.
everyone.